To some health-related stories, Bridget Ababu still recalls the moment a simple cough changed her life forever. What began as a mild irritation soon escalated into weeks of sleepless nights, chest pain and extreme fatigue. Sarah Penko reports that when she started coughing up blood, it became clear the situation was far more serious. She was diagnosed with tuberculosis.
My name is Bridget Ababu, a TB survivor. My TB journey was not easy. I went through years of illness, including severe coughing with blood, partial blindness, paralysis at a time, before finally I was diagnosed with TB, of which its complication resulted in loss of lung and left a right lung fibrosis. I was put on medication for 6 months. After the 6 months, that is when it relapsed. I have to be put on different treatments because the first medication failed.
Today, Bridget is TB-free, but recovery has not come without challenges. Bridget says she continues to deal with complications linked to the illness, while also facing stigma from people who still misunderstand the disease.
The stigmatization started right from the hospital when I was diagnosed with tuberculosis. That is when some nurses tried to pull back away from me. Some people didn't want me to come close to them. And even in the community, people were tagging that I'm having HIV. Others were saying I'm a witch. People were not buying from my mother because they thought I am having HIV. And then during the TB, I deferred my education. I was in class 6 when I had the first susceptible tuberculosis. That is when I stopped school. So I stayed home 2 years. People didn't even want me to join their groups in class.
Now determined to make a difference, she is calling on policymakers to rethink interventions and provide stronger support systems for TB patients.
Nutritional support we have for TB patients is only for the multi-drug resistant. But when you come to those having the susceptible tuberculosis, it is not like that. So I will urge the government to put in much effort. We need more funding.
Bridget's story is not an isolated one. Morrison Richmond is another survivor of tuberculosis. Like Bridget, his journey has been marked by physical, spiritual, and emotional struggles.
We went to fetish priest, plenty churches. They gave me different types of aquanchere, but still nothing works out. So it was the hospital that I even got to know that there's a sickness called TB. And then when I came home, I was rejected, not by my family members, but my friends, my classmates, my church members. I was isolated, using my cap, my towel, my everything alone. It was very bad. I felt rejected.
Tuberculosis remains a major public health concern in Ghana, with thousands of new cases recorded each year. However, many cases go undiagnosed or untreated due to stigma, low awareness, and delays in seeking care. Despite being both preventable and curable, misinformation about the disease continues to fuel fear and discrimination.
We need to take the testing from the laboratory into the homes. That is when we are sure we can get it. And this is where, for us as civil societies who operate in hard-to-reach communities, we believe that this is what can help us to achieve the target of 44,000 people being linked to care. So we need to invest more into case finding.
TB is an airborne disease spread through droplets when an infected person coughs or sneezes. Common symptoms include persistent coughing, chest pain, weight loss, fever, night sweats, and fatigue. The stories of Bridget and Morrison serve as a powerful reminder that behind every statistics is a human life defined by struggle, resilience, and hope. Sarah Penko, TV3 News, Accra.